Very good evening, everyone. I hope everyone can hear me loud and clear.
Yes.
Yes.
Yeah, thank you. Yeah, myself Rakesh, Manas coordinator and working currently as a lecturer in psychology and Rajamahendravaram Degree College. So, I welcome you all to the internship Infertility Counselling. Actually, it is not an internship for this batch. It's going to be a certificate course, which will be for 90 hours. So, I will be monitoring and supervising the course. So if you have any doubts regarding material class, just text me in WhatsApp. I will update you on WhatsApp. So regarding internship, it will be a 90 hours intern. Uh, I am getting internship. I sorry, certificate course. It's a 90-hour certificate course. We will be having 30 to 40 theory hours, and rest are allotted into assignments, case studies, and other activities assigned by your mentor. Right? So, Dr. Narayana, can you please introduce Pushpa madam to us?
Yeah. So, very good evening. I'm Dr. Narayana. I am a professor of psychology from Department of Psychology, Adikavi Nanna University, which is in Rajamahendravaram, Andhra Pradesh. So, I welcome you all for this a unique and wonderful program, Infertility Counselling. And this is I can say that the first time in India. So, we have started this infertility program. So, I mean, I can say that you can never find this kind of program in throughout India. Maybe I don't know about abroad and all, but this is a unique program we have designed, and Dr. Pushpa is the key person for this. And as usual, it's a tradition that So introducing the resource person for the group, and Dr. Pushpa Ragaveni. I mean, she did her psychology from Andhra University in the year of 2005 to 7, and after that she was trained under the guidance of Dr. Prashantham in CCC Vellore. Then she joined in Cloud9 Hospital as an infertility counselor. And I just want to mention one more thing is that I proudly say that she is the first infertility counselor in India. And I think I mean, no one come forward to even for prove that. I mean, she is the first infertility counselor. And after that, Cloud9, she worked for Apollo, Nova, and many other hospitals. And now she is working in Esha Infertility Counselling, and she is also in the admin role now. And I can say that she is one of the managing partner of Esha Infertility Center, and which is in Hyderabad. And I just want to mention one more detail that she is my classmate. And we both are, we studied in Andhra University, and she has almost, I can say that 14 years of experience exclusively in infertility. And she worked for infertility as well as some relationship counseling and family counseling and many other issues. And mostly she's her focus is more on infertility and couple counseling. And I think I have mentioned each and every point about her. And she is one of the famous psychologists in Hyderabad. I mean, why I am mentioning Hyderabad means that she is from, she is in Hyderabad from last almost 10 years. And maybe you can find her in Practo, and you can read her, patient reviews about Dr. Pushpa. I can say that even it's not because of she's my friend or she's my well-wisher, not like that, but I can proudly say that she's one of the best trainer. And she also worked for COD, which I think which is not existed now, a Center for Organizational Development.
It's still there. It's existing.
Still there? Okay. Sorry, I'm sorry. So Center for Organizational Development, which is the one of the best training institutes in India, um, and this is all about the Pushpa Ragaveni. And now I just want to give some details about this certificate course. So even Dr. Pushpa was having some kind of questions that why this is certificate course, and previously we call it as internship and all. So previously we have completed 2 batches, and even those 2 batches are we call it as an internship, and we used to give the certificate as an internship in infertility counseling. But now, so I proudly say that the Manas, the Academy of Psychology, is collaborated with many universities. Especially recently, we have an MOU with the Adikavinana University and all. Then we thought that we want to introduce some certificate courses. So these certificate courses will helpful for the people, those who trained under the roof of Manas. Because when you go for the job opportunities or somewhere, maybe they will consider internship, but they'll give more preference to the certificate course because they need some authentication. So that is the reason we have changed the name internship to the certificate course. But if it is internship, we used to have only 30 hours uh, course, but now we converted into 90 hours because 30 hours theory and 60 hours activity based and case study based. I mean, convenient of the people and students. So we do have only weekly 2 days, and each day around almost 2 hours. And she will take Tuesday and Thursday, every Tuesday and every Thursday, and she will give you some activities and case studies. And even I do participate in this certificate course. Maybe now, I mean, sometimes I may be off, but I will be monitoring the entire course, and maybe we can have a good discussion, and we can have case presentations and everything. And now I invite Dr. Pushpa to take this platform. And I mean, today as we announced introductory class, so maybe she will explain how the course will be and what are the contents she's going to cover, and so how the course will go on. So I welcome Dr. Pushpa.
Thank you so much. Thank you for a vast explanation about me. Welcome all, welcome to the course. So before, I don't think I need to introduce anything about me because Narayana has already done everything. But before we start the process, I think it's better I get to know about you guys, right? And I still can't see my students' faces. A lot of people did not switch on your videos. And Nirmal Kumar, you actually look good with open hairs. You can actually leave it. So I wanted to know from you people about you first, and then we will get into what would we all include in the course. All right? So I want to basically know your name, where you basically from, which language do you speak, what is your favorite food, and what are you expecting in this session. So along with this, I want to know your comfortable language also. Good. So all you need for this training is you need to basically qualify minimum 10 hours of classes, theory and assignments. Otherwise, Narayana will not give you the certificates. So you have to make sure you have enough attendance, and make sure you have a mobile or a computer with good internet. Otherwise, you'll miss a lot of sessions. You'll not understand if there is a lag in communication. If the internet is little slow, try to upgrade it a little. Always have a notepad and pen with you. Make sure that you make a notes if you have any doubts. This is going to be a very interactive session. We will keep talking. You can ask me any questions in any language that you're comfortable. It's not that you should talk only in English or only in Hindi. You can always talk to me in any language. I'll try to respond to you. I want it to be more interactive so that you'll learn a lot from that. Mere questions adagakapothe, you will learn very little about it. Okay, so talk to me in whatever language you're comfortable. Don't get worried that you will be judged here. Just feel comfortable about it. And I want you to have commitment to learn more, and commitment to help the society. Mainly, infertility counseling needs a lot of counselors. We need a lot of young and dynamic people here, because there's a lot big need for infertility counselors. There's a lot. Today morning, I went to Kukatpalli in Hyderabad, and I have seen almost 6 fertility centers in the same stretch, in same road. So you can imagine the chances of you getting good jobs in infertility centers also. There are like vast number of hospitals available, because the infertility problems are increasing a lot. So I want you to have a proper commitment to learn more, so that you'll be able to help the people who comes to you. Clear with what you need?
Yes, ma'am.
Yeah. So about this course, it's going to be a comprehensive course. It's going to be 30 hours of theory, and you will have 60 hours of in-depth training, which you will be doing on your own. I'll be giving you assignments, which Rakesh and Narayana will be monitoring it. I will also be looking at it. So you have to do a lot of practical sessions. I'll be giving you practical approach of how to handle it. I'll start giving you cases, and probably you can start practicing within yourself, and keep us posted on how did it went, and if there are any doubts or problems, I can always guide you on that. So you'll have exams, you will have case writings to do throughout your throughout your course, and you'll have foundation for practice. We will give you that chance to give you a proper practice during your session, and you will have a certificate of performance letter. The good performer will always be given a best excellency award. So make sure you do it well. The more interactive you are, the more chances that you would get this. And if you get a good excellence based certificate, then it will be helpful to you in the future jobs, if in case you're going for any. So your roles and responsibilities basically are that you have to attend 2 sessions in a week. So it will be like at a stretch of 2 hours continuously. I'm pretty much sure you will not feel bored during the sessions. You can just keep talking to me so that you'll not feel bored. If you're just listening to it, then you will start feeling bored. Rather, let's make it interactive so that this 3 months would go just like this. We can learn a lot by having interaction. So it will be on every Tuesday and Thursday from 7:30 to 9:30. So mark your calendars right now so that you don't forget about it. But still, you will keep getting a lot of reminders, including to me from Manas. They're very sincere about it. They keep giving us reminders. So you can always do that. And you have to always complete your assignments. Whatever assignments I give you, make sure you complete it on time and keep posting. Rakesh will keep telling you where to post. So you can post everything in that. Any doubts, you can always ask me at the end. In between also, if you want to stop me and ask, I have no problem. But if it is at end, I'll try to give you a couple of minutes only for the questions to be asked. So you can make a note of it and keep asking. But I have a habit of always stopping in between and asking if you are clear with it or not. Because I don't want to go it in a stretch without understanding whether you have understood it or not. Okay, because all I'm expecting is once you're done with this certification course, you should be ready to get into counseling centers or the infertility centers and start working. So I want you to basically understand every single aspect, and I have a lot of patience. I can explain you again and again. I have no problem with that. So utilize whatever chance I'm giving you. So keep asking, bombard me with all the questions, and I have no problem with that. Okay, and follow your superior's instructions, mainly what Rakesh tells you, because he's gonna monitor all your homeworks. Okay, and go through all the reading materials that we give you. If there are any questions, we have a WhatsApp group that is already formed. So in between, in case you're studying something and you have some doubts, drop me questions in that. I will try to respond to you as soon as I'm free. If not, at least I'll respond to those questions in the starting of the next class, if in case I don't get time, but mostly I will. Yeah, okay. And definitely try to respect the view of the other person, because this is an interactive session and I want everybody not to feel that they're judged. Feel free to talk to me. So if somebody else have a different opinion, please respect that for sure. Okay, and you can also talk to me. You can debate with me. I have no problem. You can always keep debating. If I say something and you don't accept with that, keep debating with me. And please cooperate with the management, the Manas team, because even I try to cooperate to them. So please follow whatever instructions they give you, and make sure you learn and have a great future. Okay, so let's see what all you would include in this course, so that we will see the expectations of the course module. If there is anything that you want me to include, I can definitely do that on infertility. I think I did not include about PCOD in this, but one of you wants to know about PCOD. So during the course, probably just remind me about it, and I'll definitely talk about PCO and explain you everything about it. Okay. The first thing is, we will start the course with basic understanding of what reproductive system is. When you're talking about infertility, there's a lot of science behind it. There's a lot of medical background that you got to understand. So I'll start explaining you about the male and female reproductive system. Probably you read all this in your 10th class. You must have got it, but then maybe it is not so clear, or probably it's not in your mind properly. So if you're trying to deal with the infertility patient, it's very important that you understand the physical aspects. Mainly, you are supposed to understand the treatments, because patient generally talks to you only about the problem. And how do you bring it to the psychological aspects of the patient? Again, depends on your skills. So if you understand the treatment problems and what treatment would happen, suppose a patient treatment got failed. They're trying for a pregnancy. They tried everything possible and treatment is failed. And when they come to a counselor, they will not be able to distinguish between only the emotions and the theoretical and the medication altogether. No, so they'll be clubbing it all every time, and they keep talking about why my treatment must have failed, what must have happened to me. So as a psychologist, I think you should have a basic knowledge about all this, and you can always correlate the doctor's finding about it. That will help you. So we will start with understanding about the basics of male and reproductive system. Male and female's reproductive system. And then we will try to identify what is the psychology of infertility, what all you have to understand, how did it start, what is important and all that. And then how does it feel being diagnosed as an infertility patient, because people who are going through infertility challenges are basically not patients. They don't have an illness. It's not like a cancer or AIDS or, it's not an illness, but it is about they having a goal in their life, which is expected from the whole society, and then things are not happening to them. Okay. And that the basic life crisis that is happening to them creates a lot of stress levels. That is where you are required in that place. So it is important that you understand what is it, how does the patient feels when it is diagnosed that you are an infertility patient, because from your childhood, I remember everybody would be imagining that once probably at future you'll have a child and you have to take care of the child. But when that doesn't happen, how do they feel? That's what I'll be covering in this. And how counseling helps infertility patients. And that's first thing that you have to know, because if you don't know what you're going through, then you'll not be able to help them. Who needs counseling? With the role of the physician, the doctor who treats them, basically the fertility experts, the role of them and the counseling, and what kind of relationship you should have with the nurses and the staff around, so that you deliver the right thing to the patient, basically. Okay, so we will talk about what expectations the management would have if you join some place, because infertility counseling is still an evolving subject. Not many places people would generally believe that this is what a psychologist should do. There are a lot of different expectations which management would have, and I also teach you how do you handle that management so that you are successful in your career by fulfilling what they want, and make sure that you follow your own ethics of psychology. Okay. And we'll be talking about all the ART procedures, about what is ovulation induction, what is an IUI, IVF, ICSI, and TISA procedures. These are all the medical procedures available. So we'll be talking about all this, and how does one feel during the ART procedures when the procedures are happening, what all they go through, what are the stress levels they would have, and what kind of impact they will have on the relationship. I'm sure a few of you said you're the relationship coaches, like you basically do counseling therapies. So you need to understand how the infertility basically impacts the relationship. Only then you will be able to handle counselors, relationship counseling in infertility patients. Probably patients would come to you as an infertility problem, as a relationship problem, but behind that they might have some infertility episode going on. So if you understand that, you'll be able to help them in a better way. And we would see how both male and female handles infertility in a different way. And psychosocial evaluation, or like how do you basically take the history. I'll give you even the basic history sheet that I want you to basically follow. You can always add on to that, but to start with, that will be the best thing to start, so that at least for the first session you have a structure of how you want to talk and what kind of information you have to take from the patient. And psychotherapy, and how does the psychotherapy and any kind of medication help the infertility patients? How should you do the individual counseling for each patient? How do you do a couple therapy for infertility patients? And how about the support groups? I don't know how many of you are doing support groups or know about support groups, but for infertility patients, support groups work really well. So support group is one thing that I want you to know. Sexual counseling, because this is a very, very important thing in infertility, because it impacts a lot. It impacts a lot of people when it comes to sexual aspects. That plays a major role in wanting to have a child. So I'll talk about sexual counseling. There are chances of a lot of pregnancy losses, a lot of people who will have miscarriages during the treatments, or there are people who would come maybe during 6th month or 9th month having a miscarriage and losing the whole hope of wanting to have a child. So we'll talk about how do you handle that crisis moment, because that will be the most vulnerable state of any infertility patient. They've tried so much, finally they're pregnant, and then that did not result in having a live child. That is very traumatic for them. So I'll teach you how to handle that. And if you remember seeing in the newspapers, like one person has given birth to 4, 5, 6 children at a time. So that is called multiple pregnancy. So we will also discuss about if there is a multiple pregnancy, how do you handle, how do you counsel them, because there'll be a lot of ethical and fears about how they'll be handling the treatment part. So we'll discuss about that. And there's a lot, we will be discussing about third party reproduction. That means if they don't have their own eggs, or they don't have good sperms in them, if they have to take a donor egg or a donor sperm, it's difficult for them, or to go for a surrogacy. It's basically difficult for them to accept the scenario that I have to take somebody else's egg and try to become pregnant, or I have to take somebody else's sperm and try to be a pregnant. So there might be a lot of conflicts within themselves. They might be having conflicts within the couples. So we'll discuss about all that in that particular session. We'll also talk about alternate family building, not only about the treatment. I think we should be equipped to talk to the patients if they want to go for a adoption, or if they are wanting to just live without a child and still okay. If you want to go for an adoption, you can always help them with what could be the consequences of that. And I think you should have enough skills in hand if they want to choose that, because as a psychologist, all you can do is encourage the patient do whatever they want to do. It's not that you have to keep telling them, no, you should have a child in your life. If there is no child, there is nothing that you can do that makes your family fulfilled. We are not there to say all that. We are there to encourage patient to do whatever they want to do. So if in case they want to go for an adoption, or they want to live without a child and just have a happy family, just have a happy relationship between the couple, it's completely fine. You have to know how to talk to them about that if that was a choice. But we need to basically distinguish, are they doing it because they are upset or stressed and they're tired of the negative results or the treatments and so they want to have this, or they're really prepared psychologically that they're okay to go for an adoption or live without a child. So adi aa clarity meeku undi ani ante koncham help avutundi. So we will discuss avi kuda, and if there is anybody who wants to end the treatment, like if they're going for adoption kani lekapothe if they're going for involuntary childlessness, pillalu oddu anukuntunnaru, then I will also explain you about how do they end the treatment. See, for maybe like 3 or 4 years they continuously took treatments and all of a sudden they have to stop it. You just can't abruptly stop. So as a counselors, you have to make them go through the process of from this going to the next level. So we will work on that as well. And parenting after infertility, a lot of people think once you're pregnant and you are having a child with infertility, our role is over. No, all this patient, I am working in this fertility centers from last 14 years, and every patient who delivered the child will come back to me again for at least my personal consultations after 2 or 3 years, because parenting after an infertility is not easy, because for them the child becomes so precious. Inta kastam tarvata oka child vacharu, and that is very precious for them, and they try to pamper or give too much attention to the child, and then there will be behavioral problems. So, and they always feel the psychologists who already know me will be the best person to understand what I'm going through. So they will try coming back to you, and if they come back to you, you should not be in a position to say no, I'll only handle adults, so I will not be able to handle this. Definitely yes, you can always refer the child to a child counselor, but then the parent is already attached to you, so at least you should be able to take 1 or 2 sessions for them and then do the referral of the child to the child psychologist. So it's better that you know this, so I've added this as well. And how this treatment impacts on the child, because there are a lot of people who feel uncomfortable or they feel left out, or they most of them feel that I'm a test tube baby, so people might not accept. How will the society treat if somebody points out on them that you're a test tube baby or somebody abnormal? It's difficult for the child. So it is important that you understand what is the impact on the child about this ART treatments as well, so that it helps you basically. And we will also know about ethical and legal aspects, because there is a lot of ethical aspects that we need to consider, both from ART and from the psychology background. So we'll work on both of that, legal and ethical aspects. We'll discuss about it. We will also cover counseling lesbians or single women who wants to have a child through ART procedures, because it's not going to be easy for them. They have to go through a lot of treatment process, and they are also supposed to be ready for the consequences from a society. So I think there will be nobody else better than a psychologist who can prepare them for the worst outcome so that they can handle the situations better. And we will have a lot of case studies while going through all these sessions. And so this is the overview of what we're going to handle, what we're going to work on this next coming 3 months. If there's anything else that you feel it can be added, do let me know. I would be happy to help you with those things. And if you have any doubts on any of this course model, anything, you can feel free to talk to me about it now. Girls?
Yeah, it's very much clear, Pushpa. Thank you.